Hi, I'm Dr. Anumehavalla. I'm MD Medicine and I'm back with a new video. This video is about the importance of lifestyle modification in patients of diabetes mellitus type 2. Have you ever heard your doctor say that you caught diabetes? You catch cold, you catch COVID, you catch tuberculosis, but you never catch diabetes. You develop diabetes. Diabetes is a result of months and years of your unhealthy lifestyle. In order to know the relationship between diabetes and lifestyle, you need to know a bit about the basics of diabetes. Diabetes is actually a state of insulin resistance. Insulin is the hormone which is responsible for keeping our blood sugars normal. In a non diabetic person with normal body weight and good insulin sensitivity, even in the fasting state, there is small amount of insulin in the blood, which is responsible for keeping our fasting sugars normal. After food intake and absorption of glucose from the food in a normal person, insulin is released in an appropriate amount as per the sugar burden from the food, and it effectively pumps out the sugar in the blood and pumps all those sugars into the liver cells, into fat tissue, into actively exercising muscle cells, and thus lowers the blood glucose. But this happens in a person with good insulin sensitivity and ideal body weight, good fat distribution. In diabetics, also insulin is present, but because of the insulin resistance, body do not respond to the presence of insulin. Insulin cannot effectively pump the sugars inside the blood vessels into the various other cells of liver or fat tissue or muscles. So, sugar levels are always on the higher side, both in the fasting as well as in the postprandial or post-meal states. But the question is, why is there insulin resistance in diabetics? I'll tell you. It is because of their lifestyle. Diabetics, because of their poor health activities or poor lifestyle, accumulate bad abdominal or better say visceral fat. It is that fat which we see on our abdominal wall, which is present even inside our abdomen, around our internal abdominal organs. This is called visceral fat. This abdominal and visceral fat is a really bad one. It releases lots of harmful substances, which is actually responsible for development of insulin resistance in the diabetics. The more abdominal and visceral fat you have, the more insulin resistant you are. And in order to reverse or decrease this insulin resistance, you need to shed this visceral or abdominal fat. And only method to shed this visceral or abdominal fat is by adopting a healthy lifestyle. Even if you control your sugars very well by your anti-diabetic medications, and if you do not bring a change in your lifestyle, you are not going to benefit much. You'll have to increase your medicines very soon with time, because the basic problem of insulin resistance will still be there and it will keep increasing because of your visceral fat. So, the best way is to adopt a healthy lifestyle and shed the bad abdominal or visceral fat. I know behavior change is a difficult thing, but let me tell you, living with a non healing ulcer is also very difficult. Living with a weak heart is also very difficult. Living with less functioning kidneys is also very difficult. Living with a paralyzed limb is also very difficult. So, I would advise the only way to fight with diabetes in an effective way is to adopt a healthy lifestyle. I'll end it with a good quote here. You are free to choose, but you are not free from the consequences of your choice. You are free to choose continuing with your bad lifestyle, but you're not free from the repercussions or the consequences of your bad lifestyle. Choose right. I'll be back with a new video very soon. Till then, see you.